So a warm good morning to one and all. I am Dr. Adida from Vishaga Hospital, presenting today a rare case of retinal dystrophy with CNVM in a young child. Coming to the case history, a healthy 9-year-old male child presented with gradual painless blurring of vision in both eyes since 3 months and distortion of images in the right eye since 1 month. He also noticed difficulties while coming out of bright surroundings to the dim areas since few months. There is no history of previous eye checkup, spectacle use, diplopia or trauma. There is no significant past personal or allergic history. There is no history of night blindness in the family. All the developmental milestones attained appropriate to the age. General examination, vitals, systemic and external ocular examination were normal in both eyes, and the best corrected visual acuity was 618 in right eye with a near vision of N8, and in left eye it was 66 parts with a near vision of N6. The intraocular pressure was normal in both the eyes, and the color vision using Ishihara charts was normal in both eyes. The anterior segment findings of both eyes were normal. Coming to the fundus examination right eye, we can see irregular hypopigmented lesions over the retina, sparing a part of retina above and below. And there is a yellowish white lesion over the macular area with a subretinal and intraretinal hemorrhage. Coming to the left eye, we can see irregular hypopigmented areas and which is sparing a part of retina above and below with a healthy foveolar reflex. So based on the clinical history and the examination findings, we came to a provisional diagnosis that there is simple myopic astigmatism both eyes, probably a retinal dystrophy which could be a row dysfunction both eyes, and CNVM right eye. Our differential diagnoses include Best vitelliform dystrophy, congenital stationary night blindness, sorbus fundus dystrophy. So we move ahead with the investigations of autofluorescence, OCT angiography, visual field, and ERG. So on investigation, the autofluorescence showed the similar lesions that we see in the fundus image, and in the OCT we can see the foveal contour is distorted with a hyperreflective foci we can see here, and we can see a subretinal hyperreflective material. So this was the findings in the OCT. Coming to the OCT angiography, we can see a hyperreflective lacy pattern which is suggestive of a neovascular membrane. Coming to the left eye, we can see that lesions corresponds to the autofluorescence, and the OCT was normal, and OCT angiography of left eye was found to be normal. Coming to the visual field, even after repeated doing of visual field, we couldn't get a reliable visual field because it's a 9-year-old child. And coming to the ERG, we can see overall that there is a generalized depression of the amplitude, and we can see in the scotopic range there is absent A wave in the 0.01 ERG, and there is a depressed amplitude of the B wave, while both the waves are depressed in case of scotopic 3.0 ERG, and there are diminished oscillatory potentials in scotopic 3.0, and photopic ERG 3.0 shows diminished amplitude, and in photopic 3.0 flicker also we can see diminished amplitude. So it is suggestive of a combined rod cone dysfunction. So our final diagnosis based on all the investigation modalities were simple myopic astigmatism both eyes, retinal dystrophy, probably the rod cone dysfunction both eyes, and CNVM right eye. So clinically and on investigation we have seen that there is an activity present. So we move ahead with the plan of care to administer injection anti-VEGF to control CNVM bleed, to follow the patient to look for any progression of this condition, and explain the prognosis of the condition, and the need for multiple injections were explained. So this was the result what we get pre and post intervention of injection anti-VEGF. So the lesions with the heme that we see in the investigation and the OCT angiography has disappeared in the first month of follow-up post intervention anti-VEGF, and over the 2 months follow-up also we can see there is no new lesions or activity noted. So only one injection of anti-VEGF is sufficient. We stopped there, and we are monitoring the patient every monthly, and we are actually doing the Amstel monitoring for the patient also. So there are literatures in which different various retinal dystrophy presented with CNVM, which is treated with injection anti-VEGF, and retinal dystrophy with such an atypical presentation we couldn't find any articles. So my take-home message is this is an atypical presentation of retinal dystrophy with rod cone dysfunction. Even this atypical presentation can also be presented as a CNVM, and intravitreal anti-VEGF could be considered as a treatment option in such a scenario also. So these are my references. Thank you.
What was the cause for CNVM?
Ma'am, the retinal dystrophy can itself resulting in the thinning of the RPE, resulting in the CNVM.
And one injection was given, right?
1 month.
So the child is on follow-up.
Yes, ma'am. So we have done 1 month follow-up and 2 month follow-up. The lesion was stable. There is no activity noted later. Vision was normal, sir. There is no further improvement in the vision.
Dr. Madhurima, ready?